Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to The Power of Sleep on Health and Wellness. In our first episode, we explored the critical role sleep plays in maintaining physical and mental health. And in this episode, Dr. Shelley Dennis is back, and we are going to be discussing practical strategies for improving sleep quality and managing sleep disorders. And our goal is really to equip you with actionable tools to support not only yourself, but also your patients. Dr. Dennis, thank you for joining us. Welcome back.
Thank you. Glad to be here.
All right. Are you ready to jump back in?
Sure, I am. I'm here, ready to roll.
All right. Well, we covered a lot in the first episode, and I just wanted to ask you before we jumped into these strategies, was there anything you wanted to just reiterate, or maybe you didn't get to touch on in the first episode that you want to just kind of throw out there?
Well, just one key little thing. I think we did a really good job of covering the topic. But there was a study done by Dr. Singh here in Michigan, actually, who's a sleep specialist. She's a psychiatrist. Okay. What they did is they did probes on the brain to see where the electricity was after somebody had sleep deprivation. There were two areas they looked at. That they saw that just keyed out. The prefrontal cortex, the part in the front of your brain, which is where you do executive functioning, had less body supply after somebody was sleep deprived for several days. This was a normal person without comorbidities, young. I believe most of the subjects were in their 20s or 30s. The second area that showed up was the thalamus and the amygdala, which are areas of emotion. They had more blood supply to that area.
So you're more emotional when you don't have enough sleep.
You're more Candace, you're more emotional, and guess what? Your executive functioning or your judgment's going to be decreased. So, making a critical decision during a time when you're sleep deprived
Not a good idea,
because you're on emotion and you might not be making a good judgment, and you may be a very prolific, wonderful person who can do really well. But in sleep deprivation, there's going to be a problem. Here's a perfect example. When somebody gets into the car and they're sleepy. Oh, I'm okay. I can do it. Why? Because they want to get home or go where they want. Okay? So their judgment is impaired for them to get in the car. And then when they drive, what are they going to drive like? Fast. Because they want to get home. There's a perfect example.
You're not wrong. And your example, it really goes back for me personally, because when I was working night shift as a nurse and I lived an hour away from the hospital, and so when I would get in the car in the morning to drive home, the longer I had to drive home, the madder that I would get. I was not nice. Leave me alone. I just want to go. I want to get home. I just want to go to bed. So I can relate to exactly what you're saying.
How did you drive? Be honest.
I was probably driving faster than I should have.
This is such a perfect example.
Yes.
Okay. Here's another one. Exactly. You're working all day. You're sleep deprived. You're going up on a ladder. Okay. You got to reach that last little piece. Okay. If you're not sleep deprived, you're not going to reach for that because you're not going to make that you're going to make a good judgment. Okay. So right there, you're asking for an accident. Okay. Or somebody, fall prevention. I do a lot of stuff with fall prevention. People who are sleep deprived go outside and there's, shadows and they got the wrong glasses on and I'm pissed because I'm tired and I got to go to the mailbox. Okay. They're going to be much more prone to fall because they made the judgment of going out while they were sleeping, and because of the decision they made. So this study, ding, 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 hits so many things, and it's so right.
It does. And those are really great points too to talk about is how sleep deprivation, where it affects us. And I definitely, I mean, even the story I shared in episode 1 about when my daughter wakes up, I can tell she's not had enough sleep because she's crying. Again, emotions. It's very emotional. Can't make decisions, doesn't understand why she's crying. So
Ding,
you
ding,
see
ding.
it all ages. It shows differently, but it also is in the same areas. So good points.
But I'll take it to the next level. You're
Uh-huh.
seeing a patient or working with somebody, and you know they're sleep deprived. You got to let them know this. Look, I want you to be extra careful. You need to be present at the moment because here's what's going on. Okay? We're going to try and work on your sleep. It has to be a key thing. But in the meantime, I want Mr. Jones, I want you to be careful. Okay?
Yes.
Make an extra effort to think about what your decision's going to be or how you're going to react. Maybe just take a rest.
Yes. So, and I really think that really leads us into, kind of bridges us into those. What are some of the evidence-based strategies to help with improving sleep quality in ourselves and in our patients?
Okay. Excellent. So you want to establish a nighttime routine, like I mentioned before. As the evening's coming on, 6, 7 o'clock, by that time you should have limited your caffeine. Make sure you're not even eating a heavy meal. The lights should go down. Now you don't want real bright lights. Okay? Try and go to bed at the same time or around the same time and wake up at the same time so that you get that. Remember that circadian rhythm. You get that kind of working well. And you want to do a healthy sleep environment. It should be cooler. You should be in a comfortable bed.
Yes.
Okay.
I
You
like
don't
those
really want to
ideas.
drink it. Like if you have issues with getting up, peeing in the middle of the night, maybe not drink so much there so you don't have to get up. Okay. Make sure the room is dark. Turn off electronics so you don't get emails and messages. Okay. Avoid large fatty meals. Maybe meditation, reading a book, white sound and whatever you find that do it. Maybe do a little stretching before you go to bed. Like what should you exercise? Have a big bing, 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 bing exercise right before sleep? No, absolutely not. That should be early morning, early afternoon, depending on how your schedule goes, or both, whatever. So those are key things that we want to do. Controlled breathing, mindfulness, Tai Chi, different things that whatever kind of works into your schedule. And it should be a fairly regular schedule. Doesn't mean you can't go away from that at all, but then your body gets into the circadian rhythm, and then melatonin knows when to, the natural chemical you mentioned, knows when to start increasing.
Right. Now, one of the things I was going to ask you too is, I know we talked about not doing heavy workouts, exercise workouts, but, helping with the circadian rhythm. What about if you ended your evening, maybe after dinner, with a walk outside? Would that, help increase our melatonin or, help with our circadian rhythm?
I think that's an excellent idea. Maybe not super close to bedtime, but let's say right after dinner. I mean, you probably want to wait a little bit because you don't want to be walking a lot on a full stomach. But that's very good. You don't want to be out running and jogging 8 or 9 o'clock, 10 o'clock. No. But a nice, casual, nice walk, that would be terrific. Also, you're out in the air, breathing good air.
And the
stuffed in a
sun,
house, you're not moving.
Sunset, or, sun going down.
Go with sunset. Sunset's part of the circadian rhythm. Another interesting thing is that this has been studied. This was noted just in the last several years. Each of our organs has its own little clock. Your liver, your pancreas, it all has its own little clock, how it works. Okay. So keeping it on a pretty regular schedule. And that's also important when you take medications, because how the medication affects. I'm sure you deal with that as a nurse a lot. Should the medication be taken at night? Should the medication be taken in the morning? That's become much, much more an important thing. And there's actually now specialists, circadian rhythm specialists, not just sleep disorder specialists, because this is so
Yeah.
key to health. And
Yes.
the baby boomers are have comorbidities. They're taking meds to stay
Yes.
alive and do well. When's the best time for them to do that? Or
Mm-hmm.
combinations?
Mm-hmm. And, really with that patient education too, and I know something that, we were taught in nursing school is thinking about when you take medications and really helping your patient to understand, hey, you don't take a diuretic right before you go to bed. You take that in the morning so that you can get some sleep. And that's a false risk, all of those things of really trying to get your patients to understand what is going to affect their sleep rhythms. But something else that I wanted to ask you too is, how can we as healthcare professionals do a better job of assessing and identifying sleep disorders in our patients? And sometimes, and I don't know if disorder is the right word that I want to use, because a lot of times it's just education. It's just that they didn't know. They haven't been taught sleep hygiene. They haven't been taught, how important this is and the types of routines that they should have.
Well, I think just ask them, how are they sleeping? And they go, not so good. And then delve in what's kind of going on. How long has this been going on? Do you get up and are they doing these kind of things? Oh, one night you go in at midnight, one time early in the morning. You're drinking a lot of fluid, so you get up, so you have to go to the toilet. You're taking your medicine at the wrong time. For example, multivitamins. Most of the vitamins should not be taken at night. Most
No?
multivitamins should be taken in the morning. You have to see what they're
Right.
like. B vitamins are not good to take at night. Okay.
Yeah.
So even over the counter stuff will affect it. Just ask how you're, and they go, I'm not sleeping well, but I'm not, not important. Because in medicine, it hasn't been important. But just look at, we've talked about today, how important it is. Look how it affects your daughter.
Yeah. Where can we find these circadian rhythm specialists that you mentioned just a few minutes ago? I've
Well,
never heard of them.
yeah. Well, the National Sleep Foundation is a key foundation that patients and professionals like yourself can find tons of information. And they also will have specialists that are involved with sleep. I mean, you can, I happen to be very friendly with a sleep specialist here in Detroit. That was where I kind of learned quite a bit about stuff, because she does a lot of work with athletes, that will be playing basketball. Let's say they live in New York and they have to go to California and play basketball at 9:30 at night. The 3-hour difference changes it.
That's a lot.
They're doing a lot of activity at 9:00 at night. So she figures out when they need to nap or maybe take melatonin to try so that they can get real nice sleep. Now, your average patient isn't going to be going through like stuff like that, but this is key things that happen. There's also a Matthew Walker. You ever heard of him? Matthew
I
Walker,
haven't.
PhD. He's at University of California, Berkeley. Has quite a few TED Talks about sleep. So he's a really good informational person to look up. Matthew Walker, University of California at Berkeley. And so he's a real key person to see kind of what's going on and may know about local people with circadian rhythm stuff. University of Chicago also does a ton of work. Dr. Turek, Turek, I think his first name is Jeffrey, is another circadian rhythm expert that I found quite a bit of information. I think he's in Chicago, but there's quite a bit of stuff, and it's all so important.
Yes. For our overall health, for our patients' overall health, because, one of the things that happens in the hospital is we go in your room a lot through the night. You really don't get, as a patient, a lot of sleep in a hospital. And then we have patients who, become delirious. They fall. They can become combative. And talking to you today, a lot of it makes me wonder if, the first thing we think of is maybe it's a UTI, but maybe it's they need to sleep.
Yep. I think that hospitals, especially in research areas or in big cities, and maybe not as rural hospitals might be not doing this as much, who are up on what the importance of sleep, are trying to impact this into the hospital setting. For example, like you mentioned, if somebody's in intensive care, it's so important. You got to do those you know, have to do those vitals every 2 hours or whatever like that. Maybe you don't have to turn on the light.
Yeah.
Maybe you don't need to turn on the light.
Yeah.
For the whole
We just
room.
hit a button.
You know what I mean?
Just hit a button and it's
Hit a button, you know what I mean? And get it with it and not disturb him so much. You know?
Yes.
That, you know, that might be very helpful in terms of that. Or let them be dark through the night. Or maybe put a mask on their eyes so they get the darkness. Yes, you still have to, because it's critical for whatever their intensive care needs are. But take into consideration how important sleep is for their recovery. How is their immune system going to be working well if they're not sleeping?
You know, one of the things too that I just thought this would be appropriate to point out is a lot of times people think that when you have a patient who is sedated, that they're sleeping, that their body is resting. That's not actually true. That's not the case.
No.
A lot of people, even healthcare professionals, don't realize that really their body is not necessarily resting, even though they are sedated.
Very, very valid point. Absolutely. For sure.
So I know in episode 1, you were talking about sleep hygiene. Can you really help us to understand the role of sleep hygiene and what those key components of sleep hygiene are?
Okay. Well, I mentioned some of them. Getting a regular pattern, not eating heavy fatty meals just before they go to sleep. Finding some way that's going to calm you down after dinner. Okay. Meditation, reading a book.
Yeah.
Breathing.
And so all of that, all those components come into sleep hygiene.
That's correct. All of that. Now, an added thing to sleep hygiene is worryingness. Okay. Okay. It's 8:00 at night. I'm worried because my sister is very ill. Okay. Let's give an example. The worst thing you can do is lay down when you're worried. Is he going to go to sleep if you're worried about her?
No.
I'm just giving you an example. Think about what's going on with her. Maybe you were going to call her, do what you need to do, and say, look, I've done what I have done for the day. The bed should not become a place of worriness and laying there trying to figure out, oh my God, whatever the worry is. The bedroom and the bed should be for sleeping and intimacy, not for worriness.
Yeah.
So if you're laying there and everything, like how many times, I'm sure you've had it happen. You're laying there, you can't go to sleep. Get out of there. Not necessarily go to your phone. Don't go to your phone because that's blue. Go in the other room, get some water, go to the toilet. You know what I mean? Do a couple breathing exercises, walk around a little bit, get your body ready to go to sleep again, and then go back to the bed. Laying there worrying, and then worrying that you're not sleeping, is part of that sleep hygiene.
Yes. Now, I know that we have...
I'm going to add one more point. Worrying about that you didn't get your 8 or 9 hours of sleep is also going to add to your frustration. Let's say you went to sleep at 8:00 because, you were tired. And then you get up at 4. Guess what? You got your 8 hours, right? You're not going to sleep much more. It's okay. Okay? Lay there, read a book, you know what I mean? Take a breathing exercise. Because your whole pattern switched, you've already slept 8 hours. Don't even count it. That adds to the stress.
Yes. One of the things that I have found really interesting is I have like an app on my phone, connects to my watch, tells me, it basically monitors my sleep. And so what I have found interesting is being able to see how long I'm in different areas of sleep and looking at my heart rate through them. But the thing that I find the most interesting is it looks at your routine over time and it says, okay, this is how much sleep you've gotten. This is how much you potentially have a sleep debt of. So, tonight you only slept 6 hours. So we assume you have a sleep debt of 2 hours. And just being able to see that information in real time, I have found really helpful.
But here's the thing, Candace, I want to stress. People shouldn't go too crazy with that.
No, not at all.
The apps, no. I'm not saying you necessarily do, but the apps are pretty accurate. But again, worrying about, oh my God,
Yeah.
Oh my God, I've got 2 hours debt. Is that going to help me tomorrow, not tonight?
That
Okay.
means I can sleep for 2 more hours tomorrow.
Right. Don't get too crazy about all of that. That doesn't help
Yeah.
the situation. Now, another thing that happens with the sleep cycle, which is interesting in the circadian rhythm, your REM sleep gets longer as the night goes on. Okay. So that 90-minute cycle will have more REM sleep closer to the early morning hours. So that's when you're going to be dreaming. That's why you can remember your dreams in the morning sometimes or whatever.
Yeah,
And those are
I've
very
never been
important.
able to remember mine. I don't
No?
know why.
Okay.
Mm-mm. I
Do you have
don't. And I'm
nightmares?
like, no, I don't remember anything, really.
Really?
It's
Okay.
very,
Good.
very rare that I ever remember. And if I do remember a piece of a dream, I won't be able to remember it 10 minutes later. It will go away.
Okay. Did your app say that you were in REM sleep any length of time? Were you doing?
Oh no, I wasn't looking at that at the
Okay. Be
time,
interesting
but
to know.
yeah,
Be interesting to know.
but
Because that's when, look, all the cycles are important, but you want to get to REM sleep or whatever. So.
yes, but that
Or
has
you
been
may be
interesting
dreaming
to
and not
see.
know it.
Yeah, and I think that's probably what's happening. I'm dreaming, but I just don't wake up and remember them. And if I do remember them, my brain doesn't hold on to them. They're like, all right, fly away. You don't
And
need to
that's
remember
okay.
that. Yeah.
And worrying about it isn't going to help it.
No, not at
It's a
all.
biological behavior. We can't make it work. It's not something we should push to work.
Yeah.
The sleep hygiene is the idea to make it have the most potential for it to happen. It happens. Let it just happen. It's okay. Like people getting up in the middle of the night, it's okay. It's nothing wrong.
And
with
as you get older, you're potentially
well,
going to have to get up and go to the bathroom. And that is a normal sign of aging, unfortunately.
Okay. And then what
But-
happens also with aging, you go to bed earlier, the whole circadian rhythm shifts so that you're going to bed earlier and then you're getting up earlier. And maybe the quality isn't as good. And part of that is BDNF, the neuroplasticity. It's not growth hormone. Your growth hormone isn't the same at the age of 80 that it is to 25. So that's
Right.
affecting it, So
yeah.
plus you have comorbidities that are affecting it,
Right. Yes. And so I really want to hit on cognitive behavioral therapy for insomnia. How can CBTI be used to treat the sleep disorders?
Well, if you can't yourself be able to get through these sleep hygiene things help, then you need some assistance. And an expert in cognitive behavioral, therapy can help with that. And what they do is they figure out kind of how to reduce your stressors. That's the key thing they're working on. So that you can relax.
Reframe it.
Reframe everything. Get your body to, and they teach them sleep hygiene. And cognitive behavior therapy may include some medications.
Yes.
They do sometimes. And it's interesting because the GABA medications like gabapentin and Lyrica, which are used for neuropathy, neuropathic pain, are really wonderful for sleep, for increasing sleep. So people who are taking gabapentin, I'm not trying to prescribe, but I'm just mentioning.
Yeah.
Gabapentin and Lyrica are two medications. They're anti-anxiety. They're anti-epileptic, for epilepsy, but they found out it works for neuropathic pain, helps with sleep. So those two are a couple of the medications that they will use. Sometimes certain antidepressants will be helpful and might be used with cognitive behavioral therapy, like an anti-anxiety medication that might be taken at night.
Right.
Low dose.
Yeah. Now, what are some of those risks and benefits of using pharmacological treatments to help with sleeping?
Well,
especially melatonin.
Well, melatonin, I think you have to be careful because melatonin needs to be prescribed by somebody that's an expert because you need to figure out when you need to take it. For example, if I'm ready to go to sleep now and I take melatonin and that gonna work, I need to take it 3 hours before to try to help build it up and whatever the amount is. Okay. So just taking it over the counter, you need to figure out what you're doing. There's also light therapy, that can be done in the morning, which is also part of this cognitive behavior thing. And sleep experts are using like light therapy in order to get the cortisol going and get the melatonin decrease so they get into a good circadian rhythm for the pattern for sleeping. But the risk and benefits are some of the meds will have effects on certain cycles, certain stages of the sleep. So people who are prescribing this, which would not be me, but a sleep expert, needs to know which of those medications and how that's working. Now, you also have to take into consideration some of the cardiovascular medicine. Beta blockers, calcium channel blockers. They all affect sleep in different aspects, or the combination of meds. So the primary care physician or the provider needs to understand how all of that works. Now, if you're hypertensive, you need meds for hypertension, but maybe we need to pick one that isn't going to affect the sleep so much, and a lot of the new ones are much less of a problem with that. Groggy in the morning isn't going to help somebody. Okay. No. And you want to get quality sleep. So the cognitive behavior stuff will help just going to sleep. Okay, here's a perfect example. Ambien. You know about Ambien.
Yeah.
Pretty dangerous.
Yes.
Okay. They may put somebody to sleep. It's not quality sleep. They might hallucinate. Right?
Mm-hmm.
Not
it can also make you
sleep.
really sick when you wake up in the morning too.
Yeah, absolutely. So what kind of sleep is the med doing? Or over the counter, for example. A lot of them have antihistamines. Yeah. How does that work on? That might actually make you more hyper, like Benadryl. If you took Benadryl over the counter, okay?
Yeah.
Might put you to sleep, but it also might make you hyper. So you got to be really careful about that.
Mm-hmm. So there's really a lot to think about. It's not just about taking a melatonin and I'm going to go sleep tonight. I do see a lot of, and I'm seeing it more and more with younger patients and children, really, where they take a melatonin every night to go to bed.
Well, it's pushed on TV. They probably see it on social media too. Yep.
Yeah.
And the thing is when are they taking it?
Mm-hmm.
It doesn't work like, boom, okay, it's going to put me to sleep. Or, sometimes I take melatonin, but what I'll do is I'll take it 3 or 4 hours before I go and take a very low dose of it. If I get up in the middle of the night, I know people who do this. In fact, I have a cousin that does it. She has a spray. She has a melatonin spray. She gets up in the middle of the night. She can't go back to sleep. She gives herself a melatonin spray. Not a good idea, because by midnight, 2 o'clock, your melatonin should start being decreased so that you can get to the morning part of your circadian rhythm.
Right.
Now,
so
there's
really
another thing with sleep deprivation. Yeah, is you can have hyperarousal with sleep deprivation. So I am so sleep deprived that now I'm in fight and flight. My sympathetic system is like on overload. Okay? Your daughter might have. Okay? No. So she's in fight and flight. Oh my God, I don't feel well. I don't know. Remember you said she was crying. This is very, very common. Yeah. So they're in a heightened stage of activity and energy, even though they're sleep deprived.
Yeah.
So they're stressed. They're having anxiety. And then they're not going to sleep because they're all hyped. We can't stay inside fight and flight, right? Our body cannot stay in the sympathetic part of the autonomic nervous system. Yes. What do they need? They need to be calmed down in whatever way, shape, or form, right?
Right.
And cognitive behavioral might be part of it. Depends.
So we are running out of time. We're at the end of our time for episode 2. Is there anything that you just want to make sure you touch on again before we end?
Well, I think this needs to be an important part of medicine, rehab, health. And we need to start early with our kids.
Right.
And
I agree.
When us as clinical medical clinicians, we need to think about it when we see our patients, or our patients come to see us. We see them. But we need to, I think it should be a general question. Somebody comes and they're doing well and everything's fine. Maybe you're not going to ask them. It's not a bad idea. I think it should be a key thing. How are you sleeping? They go, oh, not so good. And then maybe cue in what's going on. And maybe it isn't a huge problem, and maybe it's only the last couple days. But if it's over long term, we talk so much in our 2 episodes today, how over time, what sleep deprivation can do.
It's very harmful. Absolutely. It plays a factor in basically every type of chronic disease that we have.
It does. It does.
Yeah, I think that's really important to understand. So I'm going to wrap up this episode and just kind of share a little bit about why sleep is so important to our health and wellness. Up to 70 million Americans suffer from chronic sleep disorders like insomnia, sleep apnea. And poor sleep is actually linked to a 45% increase in developing cardiovascular disease and contributes to like every condition you can think of: diabetes, obesity, depression, poor mental health. And sleep disorders, unfortunately, often go undiagnosed, with only 1 in 5 individuals actually seeking treatment. And this doesn't just affect our patients, it affects us too. As healthcare professionals, we are at risk of sleep deprivation due to demanding schedules and also that high stress environment that we pretty much all work in. So we have to understand the importance of sleep. And I just really hope we can encourage you, and you can bring this to your patients, to prioritize sleep health. When we sleep well, we improve our performance, we improve our decision-making, and just our overall well-being. Thank you, Dr. Dennis, for joining me for this topic and sharing so much great insight into the benefits of sleep. I know you are so passionate about getting this information out there, and I could really just hear that in everything that you were saying today. So thank you for being here with us.
And thank you for the discussion. I think it was a two-way street. Very, very well. Very much so.
Yes. So to our listeners, thank you for taking time to listen to this discussion. If you found this information valuable, please share it with your colleagues. And I really encourage you to explore many of the courses that we have available on elitelearning.com to help you continue to grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.